Welcome back to Pittsburgh Living on KDKA TV. I'm your host, Carol Lee Espy, and today we're featuring 8 excellent tri-state businesses. Now coming up, we've got Art Cohen from Pittsburgh Barbecue. We have Patty Jo Lambert from the Bantam Jeep Festival, Daniel Bodner from Life Pittsburgh, Dr. Nathan Lockery from Aspen Dental, and Cookie Harris from New Image Hair Clinic. But right now, let's welcome Dr. Ian Bulow from Upper Cervical Health Centers. Welcome to Pittsburgh Living.
Thank you for having me.
And we always have to say, what is the upper cervical region?
Well, we've had a lot of responses when people look at it, first time they hear upper cervical, you know.
Yes.
What some folks don't know is that the cervical region of the spine is the area of your spine basically involving your neck.
Okay, so right at the base of your skull?
Base of the skull, yeah. So upper
Okay.
cervical care is a specific form of chiropractic that specializes in the upper portion
Just
of
that
the neck.
region.
That one area. And it's funny,
Why?
I had someone say, is that all you do, right? And I thought about that and I said, well, when somebody has a heart attack and they're laying on the ground and they get the defibrillators and they just do that one simple thing.
Right. It's amazing,
it's
right?
one of the most important things you could do in life.
Right.
And that's how I feel about upper cervical work, because
It's that one thing.
it's that one area. If you look at it, this one area is where the brain actually communicates with the rest of the body.
Okay, this is the base of the skull.
Yep, so this will be the bottom of the head.
Okay.
And these would be the first 2 neck bones.
Neck bones. And these are all that's your spinal cord.
And all the nerve fibers.
It's like, you know, it's all contained in that one little spot.
Honestly, one of the first things that I learned in chiropractic college when going through was the anatomy. And what we find is that our spinal cord is no bigger than the size of our pinky finger.
Isn't that and all the information is carried up
Everything.
and down that
Everything.
highway.
And the tragedy is that most people walk around, just like anyone who has high blood pressure or has diabetes or things like that, they can walk around and have no idea that they're walking around with what we call a subluxation, a misalignment in the base of the skull, which very often is leading to very chronic and serious health conditions. And when we go in and we find these bones twisted out of line and we correct that, we're able to help them get off of a lot of serious drugs, avoid unnecessary surgeries, and get back to living more quality life.
Are you born with that misalignment, or does this happen throughout your life? What are the reasons for this?
That's a great question. Some people are definitely born with misalignment, because when you look at the birth process, especially when you talk about forceps deliveries, cesarean sections, really long labors,
Right.
I promise you, the kids that are born in that way with the cesareans or the forceps, they're going to end up with ligament damage in their neck. And the tragedy in that scenario is that they're never checked for that. If you think about it, when a baby's born, the medical doctors take them and put them under the lights,
Right.
and they listen to the heart and they listen to the lungs. They palpate the hip joints to make sure there's no hip problems. But there's no assessment really for the integrity of the neck. And so very often over a period of time, that irritation builds and builds and builds, and we wonder why a certain percentage of the population of these kids end up with chronic colic or ear infections or bedwetting or seizures. It's not a coincidence that most of these kids had a very long and difficult labor when we look into the history of the child. So yeah, a lot of that can be from
Plus,
birth.
their heads are so heavy when they're babies. They don't have that muscle support in their neck, so it even can be exacerbated just by having this big, heavy head.
You know what's interesting about that is in the birth process, the head has, those soft spots.
Right, the fontanelle,
Yeah, exactly.
Yeah.
It actually will telescope and shrink down and then open back up. It's designed to be compressed.
Flexible, yes.
And things like cesarean sections and forceps deliveries, there is no pushing. It is all pulling by the physician. That skull was never designed to be pulled apart. It's designed to be compressed. But when it is pulled, I can just promise you, and I say this with no judgment. All my girls were cesarean section, so I do not say this with judgment, but it is the most traumatic delivery option for most kids.
Right.
Yeah.
Did you check them after they were born?
You bet I did. You bet I did.
Wonderful that you were there.
I've checked all of my kids from the day they're born. They don't always need work done, but for goodness sakes, I check them.
Right.
And it's not a coincidence that they've never had colic, ear infections, none of that garbage.
Interesting.
With our first daughter, everyone thought we were lucky. They said, oh, just you wait, your next child, they're going to be in the hospital on all this stuff.
Right.
We've had 3, and they've never had an issue.
That's very interesting.
Yeah, it's just science, just how the body works.
And of course, you came here to talk about all these things that are created throughout the life that can happen, and one in particular about, in fact, you brought a book with you, a particular, and I can't pronounce it. I want you to.
Yes, sure. Basically, there are different neurological conditions that will stem from a compression of the spinal cord.
Right.
The one that I wanted to highlight, because we just got these books in, is a condition called trigeminal neuralgia. And anyone who has nerve pain knows neuralgia means nerve pain. It's that pain you get when you have a root canal, or when you have that intense sciatic pain, or if you ever hit your funny bone, you get that burning pain in the hands.
Yeah.
The trigeminal nerve is the nerve that supplies sensation to the face.
Okay.
So patients with trigeminal neuralgia have intense nerve pain
in their face.
And it is so debilitating that they have called it in the medical community the suicide disease, because a very high percentage of TN patients end up committing suicide relative to the other pain syndromes. And it's because they cannot mentally get away from the pain. It overtakes their life.
You can't when you have chronic pain.
Yeah.
You can't.
And this book is just something that is just so encouraging and so uplifting for patients or anyone with a chronic pain syndrome, because it was written by a gentleman that had trigeminal neuralgia for about 10 plus years, and it had gotten to the point that he was going to kill himself, and subsequently on a Tuesday. And the book's called What Time Tuesday.
What Time Tuesday.
And it's really powerful. And he had all his teeth removed because they thought it was from the teeth, so they had surgery and removed all his teeth.
So he has had we have about a minute left. I want to make sure we get to the crux of his story. So he actually had work done on the...
Yeah, what I would say is this. After multiple medications, surgeries on the teeth, acupuncture, standard chiropractic, massage, prayer, he had everything done. The long story short was he came across an upper cervical office, and while he's alive to write the book, what I would say is if folks want to actually read the story, I don't want to give it away.
Right.
If they were to call our office, we have a whole case of the books in, and we're giving them away first come, first serve. They call the office, we'll send them a copy of this book, and if they'd like a complimentary consultation, they can schedule one with the team, with the staff.
Okay, and you're located where?
We're right in Cranberry Township.
Okay.
And we see patients from as north as Erie all the way down, actually as a TN patient from West Virginia. So it's central to that north-south, and
yes, it's right on the 79. So we have your website, we have your phone number. I'm sure folks are going to be calling you because they want to see this. They also probably want to talk to you about birth canal issues too.
Absolutely, I'd be happy to.
Thank you so much for being here.
Absolutely.
Now, if you would like to know more about Upper Cervical Health Centers, just call Dr. Bulow at 724-772-7060, or you can log on to uppercervicalcare.com. Now, if you'd like to advertise your products or services on Pittsburgh Living, you can give us a call at 412-575-2400, or you can email us at showcase@kdka.com. Up next, we are going to talk with Art Cohen from Pittsburgh Barbecue, next when Pittsburgh Living continues.